It's been 1 year since the World Health Organization declared COVID-19 a pandemic. So far, it's killed more than 2.6 million people and infected almost 119 million. The impact on healthcare systems and economies has been enormous. Nicola Hill takes a look at the route out of this global crisis.
For many, it's been a year of fear, exhaustion, restrictions and loneliness. Now there's some hope, a possibility life will improve because of the vaccines available. But not necessarily for everyone, at least not yet, which is why the Recovery Plan for the World, launched by the WHO and Global Citizen, prioritises ending COVID-19 with the slogan, "A virus anywhere remains a virus everywhere." They have A-listers appealing for support.
The pandemic is still raging across the globe. I'm still at home like most of you, but we've seen how we can create change when we come together and use our voices. So we got to take action to get everybody access to COVID-19 vaccines as quickly as possible.
This last year, I joined some of my fellow X-Men to be part of the global goals, Unite for Our Future, and as already been said, $1.5 billion from 41 countries was pledged to help end COVID, but we need you.
Global scientific collaboration has created the vaccines, but they're not enough to end the crisis, as experts believe immunity will wane.
A substantial proportion, maybe as many as a half of people who have had the vaccine will ultimately get another infection.
And so the focus on treatments remains. Much has been learned over the past year, such as when to ventilate hospitalised patients. This knowledge has saved lives.
If you were able to have your first infection postponed from last April to this coming April, you're much more likely to have survived that infection.
Effective medicines are vital. Dexamethasone and tocilizumab are already being used, and there are trials of other drugs that may treat patients as soon as they test positive, although determining who would need them and who should get them is still being researched. Scientists believe this virus isn't going away.
It's likely, and I believe we will still see a lot of COVID being spread for years and decades to come. But it won't be hopefully causing the severe disease, either because of vaccinations or because of prior illness.
But as the WHO and Global Citizen warn, the impact the virus has on the world depends on ensuring future vaccines, treatments and medicines are shared globally. Nicola Hill, TRT World.
Well, let's get more on this now with Tarik Jasarevic in Geneva. He's a spokesperson for the World Health Organization. Great to have you back on the program, Tarik. It's really hard to believe, isn't it, that it has been a year since the WHO declared coronavirus a pandemic. It's been a steep learning curve for pretty much everyone on this planet. What lessons has the World Health Organization learned over the last 12 months?
Well, thank you very much for having me in your program. WHO has declared public health emergency of international concern on January 30th, 2020, and that's the highest level of alert we have. And that was basically the day where we said this event, new coronavirus, has a pandemic potential. Unfortunately, a month and a half later, mid-March, we were forced to characterize the situation as pandemic because the virus was spreading everywhere. So we have seen in the past 14 months how big toll this virus has taken on societies. Not only people who lost their loved ones, people who suffered the illness, but both economically and socially. However, we have to also note that there was a huge scientific achievements being done in past 14 months. Scientific community did get together, worked on diagnostics, worked on understanding the disease, worked on vaccines and therapeutics. So we have now more tools than we had before. However, as vaccines are being rolled out in different countries, we know that this rollout will take time. So in months to come, we need to keep public health measures that are being put in place by countries, such as testing, tracing, providing medical care. All of us, we need to reduce the risk of getting infected or infecting someone else. And obviously, vaccines will help us reduce the number of hospitalizations and deaths, which would eventually help us open up gradually our societies.
This pandemic also exposed some of the deep inequalities that we've seen within societies and between countries. For example, the economic inequality, but also the divisions in terms of how much people are prepared to compromise to really help fight this pandemic. Were you surprised at just some of the ugliness that did emerge from this, from, say, the vaccine nationalism that we're still seeing at the moment, to the nationalism surrounding PPE gear? Did that surprise you at all?
Well, we have been warning from the beginning of the work that has been done on vaccines that once we have those vaccines, the rollout has to be done in an equitable manner, because there is no way we can open up global economy country by country. It has to be done in a simultaneous way across the globe. We have seen new variants of the virus being identified. And some of these variants that will come in the future for sure may be resistant to the vaccines we have. So more time we last to the virus, more time the virus has to circulate, more chances of a mutation. So we have to act quickly, and we have to act in a way that vulnerable groups are immunized everywhere. So we hope that everyone understands that, and we rolled out our first COVAX vaccines in the past couple of weeks to a number of countries, and we hope as more vaccines are coming and being approved for emergency use, we will have more vaccines to offer to vulnerable groups in every country in the world.
A team led by the World Health Organization went over to China in January in order to investigate the origins of this outbreak. When can we expect a report from that team?
Well, we expect the report in a week or next 2 weeks for sure. The team is now finalizing the report, but the team has already presented its key findings. So the key findings being that there was a transmission of the virus in Wuhan in December, more than what was believed at the time. And the most likely scenario was, as expected, that there was an intermediate species that basically transmitted the virus from its reservoir, and that's in a bat population to humans. How exactly that happened, we still don't know. Usually, to get to understand the origin of the virus takes years. For some diseases like Ebola, we are still not sure, 30 or 40 years after it has been identified. So many studies will be recommended in this report, further studies, and we hope that we will eventually understand exactly how the virus and through which way enter the human population, because that will help us fight emerging diseases in general, and this SARS-CoV-2 virus in particular, to avoid the future possible exposures.
Okay, Tarik Jasarevic, we'll have to leave it there, but thank you again for joining us on the program.
Thank you.